Hi, Dr. John Torres here on this Daily Doc, giving you the headlines for the last couple of days, things you've probably heard of, and giving you an explanation behind those headlines, getting deep into what it really means, and particularly what it means for you, your family, your loved ones, and your community, hopefully to help you live happier, healthier lives, and hopefully help you get through this pandemic sooner rather than later. And then we'll answer some questions. So if you have questions, please send them our way. We'll get to as many of those as we can. But let me go ahead and start first with the variants in the vaccines. And you probably heard over the weekend and probably last week about the variety of variants that are here. Let me get you up to date to where we are right now. The first one we heard about was the B.1.1.7 variant. This is the first one that was discovered in the UK, discovered back around September timeframe, and they've been watching it ever since. And the way it progressed is it started off in southern England and then went to London, became the dominant strain, and now it's the dominant strain in London. Well, here it also is one of those things that has become more and more prevalent. Over half the states in the U.S. now have it. And over half the states that have it, the cases keep mounting up, and we think there's going to be other cases as well. Part of the issue is our surveillance system looking for these variants isn't very robust, but the Biden administration today announced that they're going to make it more robust. They're really going to push out. They want to survey 7,000 random samples across the nation a week so they can get an idea of where these are. So anyway, this B.1.1.7 is in over half the states here, and by some estimates, it's going to be the dominant strain by March timeframe, so just a little over a month away. That's one of them. The other one is the P1 strain. The P1 strain was first discovered in Brazil. That strain has now been found in Minnesota. One person there, that person traveled from Brazil to Minnesota. And so we don't know about community spread there because it's only been detected in somebody who traveled, again, from Brazil to Minnesota. So they could have gotten it down there and brought it with them. The other strain we're looking at is the B.1.351 strain. That was the one that was first detected in South Africa, and that's the one that probably has experts the most worried about. That strain here in the U.S. has now been detected in 3 different people in 2 different states. South Carolina has 2 cases, and Maryland has 1 case. Here's the kicker with all these, is they are geographically separated. Even in South Carolina, they're not in the same city. They're separated in that state, and then, of course, Maryland is different from there. These 3, none of them have traveled, none of them have come in contact with each other, which means they got it from the community, somebody who brought it into the community. And so the concern is, do we have spread? We think we have spread at this point. We just don't know how big that spread is. And the hope is this doesn't spread much more for a very good reason. Going back over these variants, the B.1.1.7 variant, that's the one that, again, is in over half the states here. The issue with that one is it's more contagious than what we call the wild virus that's been here for the last few months. But we don't think it's any more dangerous, which is good. And it looks like the vaccines, Moderna and Pfizer, can hit it pretty well and keep it under control, as well as the therapeutics. Maybe not as well, but they hit it pretty well. Now, we go to the South African and the Brazilian one. They have a lot of similarities. What makes these variants all concerning is they are more contagious, meaning we can catch them and spread them more because what are called the spike proteins. If you look at the actual coronavirus itself, has these spikes on it. These spike proteins allow it to attach to the cell. It's almost like a lock key mechanism. That spike protein keys into a lock and holds the virus against the cell, letting the virus get into the cell and do its business. If this spike protein mutates and changes into a variant, it makes it easier to get into to attach to the cell and stay attached to the cell. It becomes more contagious. The virus can get into the cell easier. Now, the other concern is if these spike proteins, which is what all the vaccines are looking at, if they can evade the vaccine, if they can change enough to where they don't look the same, then the vaccine won't be as effective. And here's what we know so far. Pfizer and Moderna, they have tested theirs in the lab, and they say it looks like they can do fairly well against the vaccine, but they only tested it against a few of the mutations. They didn't test it out in nature. They didn't test it out in populations. The J&J, the Johnson & Johnson vaccine, which is coming out, 72% effective here in the U.S. overall, but what they looked at were severe cases of COVID and dying from COVID, hospitalizing and dying from COVID, which at the end of the day is what we want. I would much rather get the sniffles and turn it into just essentially a cold-like symptoms and be able to survive that if I get the vaccine versus a vaccine that doesn't work very well. So at the end of the day, that survival, that serious illness, hospitalization, death is the end game we want to make sure we avoid. And Johnson & Johnson vaccine, as a matter of fact, all 3 vaccines do a good job of doing that. The one advantage to Johnson & Johnson vaccine, by the time they tested theirs, they were a little behind Pfizer and Moderna. They started testing it when these variants were out there. Especially they tested it down in South Africa. There they found it it was 57% effective at preventing severe disease. But also, everyone who got the vaccine after 28 days on that single dose vaccine, none of them got hospitalized. None of them died from the virus. And the virus they had down there, 95% of people who did get the virus ended up getting that South African variant, that B1351. So it looks, again, like it does very well against the B1351 to prevent that end point of severe illness, hospitalizations, or deaths, which is, again, if we can turn it into cold-like symptoms and you recover from it, fantastic. That vaccine is doing its job. Obviously, to avoid getting it altogether is the best. And we'll talk about that in a minute as well. So that's where we are with those variants and the vaccines. Now, the COVID-19 task force from the White House had a briefing today, and Dr. Fauci, I thought, put it well. Viruses can't mutate if they can't replicate, meaning if they can't get in our bodies and they can't make more viruses, they're not going to mutate, they're not going to turn into these variants. So the best thing we can do to fight against these variants is to make sure that we protect ourselves. Wear a mask. Social distance, wash your hands, those things we've been talking about. Extremely boring, but they work very well. And then when the vaccine's available, get your vaccine. Now, the question I get a lot is, should I wait, since that Johnson & Johnson only said 72% effective, should I wait to get a Pfizer Moderna because they're 95% effective? No. The best vaccine is the one you can get right away. Number one, you don't want to wait a few months to get the second vaccine, the Pfizer Moderna, because you think it's going to work better. And number two, those numbers, you have to be really careful with them, because Pfizer and Moderna, with their 95% effectiveness, looked at getting the disease at all. Johnson & Johnson said, we don't want to look at that. We want to look to see what happens with moderate to severe disease, and particularly hospitalizations and deaths. And so they looked at two different things. And a lot of experts are saying it's almost apples and oranges when you compare them. But all of them do a good job at preventing severe disease. All of them do a good job at preventing hospitalizations. And all of them do a good job at preventing death from COVID-19. And we do know that Johnson & Johnson was tested in South Africa when that B1351 variant was very active. And so we know it can protect against there. And at the end of the day, even if you get the virus and the vaccine protects you, the vaccine is doing its job. It's saving your life, which is what we want. And then the more of us that get it, the more protected we'll all be and the less likely we'll have these variants. So that's that. Now, the other news of the day is starting tonight, 11:59 tonight. So midnight tonight, President Biden signed an executive order. The CDC just came out with their order, copying that executive order, saying on all public transportation, masks will be mandated. And essentially what they're talking about is wearing simple masks. Don't necessarily have to have the N95. But instead they're talking about are wearing masks like this one, which is a 2 to 3 layer mask that has good thick layers in it. It has that fine thread count, and that can certainly help prevent you from getting it or passing on coronavirus. So what they're saying is all public transportation, planes, trains, buses, taxis, all these things, you need to wear a mask. Everybody 2 years old and above, obviously if you have medical exemptions, that's a different story, but 2 years old and above, for the most part, everyone has to wear a mask on public transportation. And it's not just wearing a mask on public transportation. It's actually wearing masks while you're waiting for public transportation. If you're at a bus stop, if you're at the airport, if you're at a bus terminal or a subway station, then you need to wear a mask as well. That becomes effective tonight, basically at midnight, 11:59 p.m. It becomes effective. And so the hope is here, our numbers are starting to decline. And I'm looking right now at the numbers we have. As of the latest count, the last number we had was 111,000 cases yesterday. 111,000 cases. It's fantastic. We've gotten that low. Need to drive it even lower. If you remember, we were talking 20, 30,000 cases in the middle of the summer. We need to get back to that point and even lower. But at least we're not in that 200 plus thousand range of cases. Deaths are still up there. Hospitalizations are still up there. Those should start coming down as well. But in order to help keep those numbers low and drive them even lower, we, of course, have this mask mandate. And like I said, wearing the mask, N95, not everybody needs to wear that, but wearing a good cloth mask, or if you have a mask that isn't quite as good, like in this one, one tip I give people, shine it up to a light. If you can see the light shine through it, then it probably needs a little bit of help, needs some more layers. This one is a running mask, so it only has a couple layers. And so one thing you can do is put a surgical mask over the top of your face. That's your base layer. And then put the other mask on top of that one. And the beauty behind this is, what it does is it essentially snugs it to your face, so that helps, gives you more layers to make sure that essentially you have more protection. And when somebody's talking like I'm talking, as you can see, these two layers mean it's not going to move quite as much. so I can wear it a lot longer. So just food for thought while you're waiting for the bus, the train, the plane, taxis, any of those public transportations, because starting tonight at midnight, it's mandated that you, and not just you, but the operator of the conveyance, so whoever, the bus driver, the pilots, the crew on the airplane, taxi drivers, they all need to wear masks as well. And the object here is to get everybody to wearing masks as much as possible. So again, looking at the couple of headlines we had, the variants, talking about them, the vaccines that are out there and how well they work against the variant. And right now, as Dr. Fauci says, the best thing you can do is get the vaccine, which will help prevent you from getting COVID-19, which will help reduce the chances of it mutating and turning into other variants. And then the mask mandate that starts at midnight tonight. So let me see if you have any questions.
Are people dying from the vaccine?
Are people dying from the vaccine? Well, as of right now, there has been one man, a doctor, who died a couple weeks after the vaccine. They don't know if it's vaccine related or not, but they're looking into it, and there's cases of other ones that they're looking into. But you have to remember, too, that people die naturally of regular causes that they typically die of, and sometimes chronologically it happens after they get the vaccine. So it takes a while to figure out if the vaccine and those are related. But at the most, there's only been a few people that have fallen into that category. Again, you need to put that number, because I know people's concern is, oh my gosh, I'm going to get this vaccine and it's going to cause problems, and particularly I could die from it. Put it in perspective, and this is what I tell people all the time. If you look at the people that have gotten the vaccine, it's over 25 million people have gotten the vaccine, and we know of one that was associated with the vaccine that died in the time frame after getting it, but we're not sure it's directly related, and a few others that they're looking into. And so at the most, a handful of people versus COVID-19. We've had over 25 million COVID-19 cases, and as of now, we have over 400,000 people dying from it. So you're much, much, much more likely to die or get seriously ill or have complications from COVID-19 than you are from the vaccine itself. It's a great vaccine. I've gotten my first dose. I'm getting ready to get my second dose in a week, and I'm looking forward to it.
What about anyone who got COVID after having the vaccine?
So there's been a few cases of people who have gotten COVID after getting the vaccine, and there's a couple reasons behind that. One, oftentimes it's after getting the first vaccine, and they'll get the first vaccine, and a week later they'll get COVID. That vaccine takes about 2 weeks to get into effect. And right now the vaccines we have, Pfizer and Moderna, are both double shot vaccines. For Pfizer, you take one at day 0 and then one at day 21, 3 weeks later. For Moderna, it's day 0 and day 28, 4 weeks later. If you're in that week period afterwards, you really aren't getting a whole lot of protection after the first vaccine. It takes 2 weeks after that second vaccine to get that full 95%. And so people were getting sick in that time frame, which also means that they probably were already infected right around the time they got the vaccine. It just took a while to develop enough virus in their body. And so the vaccine hasn't gotten fully effective. So you can't say, well, they got the vaccine and they still got COVID. That's not the case. In this case, the vaccine, they hadn't gotten a full dosing on the vaccine. Now, there is one congressman that got first vaccine, he got the second vaccine, and then again, a week later, he got infected again, or he showed up positive, which means he was probably infected right around the time he got that second vaccine. So he didn't have that 2 week buildup after the second vaccine to get that full 95% effective. Number one. Number two, on the other hand, too, remember, these are 95% effective, 94.1 for Moderna, 95 for Pfizer. So they're not going to be fully protective. So if you get enough of a viral load, meaning you're in enough of a situation where other people who have not been vaccinated, who are not wearing masks, might be spreading coronavirus, then there is the chance you could get a breakthrough virus with this. But I know the congressman, he tested positive. He was doing regular testing, never had symptoms, which again is the important part. The end point here is to keep you alive, to keep you from having severe illness or complications. And in his case, the virus is doing its job, even though he's not fully protected, even though he got COVID-19. So again, the bottom line here, at the end of the day, we all want to go home. We all want to be healthy. We all want to make sure we don't get complications from the coronavirus. And the vaccines do a great job of doing that. So thank you for your questions. They've been wonderful. Really quick, going over the various headlines today. One, the variants, they're out there. 3 right now we're concerned with. One of them, the B117, is over half the states. It's probably going to become the dominant strain pretty soon. The other one's the P1, Brazil, only one person in the U.S. so far. And then the other one is the B1351, first discovered in South Africa. It's here in 2 states, 3 different individuals. We think there might be some community spread behind it. So they're keeping a close eye and they're doing a lot of surveillance. But the vaccines, even if they don't provide you that robust amount of protection they do from the ones that have been, the virus that's been around for a while, they're still going to give you some protection. And most importantly, they're going to save you from dying from the coronavirus, which is the bottom line. And then the mask mandate we talked about. It takes place at midnight tonight. Any public transportation, planes, trains, buses, taxis, you and the operator of that transportation need to wear masks. You need to wear a mask while you're waiting for that transportation. So if you're at a bus stop, a bus station, train station, airport, any of the subway stations, you need to wear masks. So again, just things to remember and things to do. So hopefully this helps out. And hopefully from here, the rest of the week, you have a great time. You stay happy, you stay healthy, and you have a wonderful time. Thank you.
Are you a fan of our videos? Be sure to subscribe to Worldwide Campus News and Entertainment. Then ring the bell to see all notifications about the new videos and the latest video.